I am Suni Sukanya Datta, and today we have with us Mr. Dinesh Madhavan, President, Group Oncology with India's leading chain of corporate hospitals, Apollo. Apollo has just started country's first precision oncology center, and our conversation today will largely center around this development, this very exciting development. So welcome to ThePrint, sir. And please help us understand what is precision oncology and what exactly is the center going to offer.
Hi, Sumi. Thanks for having me on the show. It's an interesting journey that everybody is going through in the last few years on the role of AI in each case persona, where the end user would come in to understand how does AI enable various aspects of one's life. In this case, we're looking at the clinical persona and what we plan to do in the role of a cancer patient who gets diagnosed from a screening modality to finally trying to understand his cancer type and how precision oncology works to create a bespoke model for him. While the human brain is a great technological marvel, it's limited by what you put it to use to. And if you put it to use to doing the mundane and the repetitive work, you're spending a lot of time in the clinical interface between the clinician and the patient, which can be done through technology. And in this case, it's the data points to AI, which can enable repetitive algorithms to actually throw up end user interface more aptly, where both the consumer and the patient are able to preempt a lot of communication, which otherwise happens in the clinician's room. And what it enables the doctor further to do is to get into the core focus of the diagnosis to the therapy and to make sure that the patient has a better chance to win over cancer when he's able to actually bespoke a cancer regime, which is very specifically built on the DNA type or the cancer type of the patient. So that's the role we have envisaged by creating AI-driven precision oncology centers, with the first one in Electronic City in Bangalore, with more to come.
Yeah. So there is a lot of buzz about artificial intelligence or AI in healthcare, especially in cancer care. So what role do you see for AI to, for cancer care in India, particularly, given that, it's just in nascent stages, right? Not many people, not many doctors or patients are still using it. So going ahead, what's the thing that we see?
So the human symptoms of various disease networks has got about 147,000 plus connections. Between that, there are about 322 symptoms, which create about 4,219 disease. And this is very definitive, and we might see it evolve, but I don't see a large shift. Imagine all of this in a data lake, which will enable a consumer and the patient to understand where is data in this entire data lake, which is present currently, to actually figuring out that how narrow it gets to understand a typical 2-3 episodical data points which drive his disease pattern. And instead of waiting for that end result to come in after multiple episodes in a clinical setting where he has to go to a doctor, imagine if the cancer care came closer to him, either through an app on his phone or a Fitbit on his hand, or through an interface, through a data push, through AI, which will keep him better informed so that he knows what he has to do when he's challenged with a condition as serious as cancer. That enables him to be better informed when he meets his clinician, and the clinician to be better informed of the condition when the clinician meets a patient, so that the enabling bridge between the caregiver and the care receiver is largely reduced, so that focus could be is how do I help the person to win over cancer. AI is in its very nascent stage currently. There are multiple projects running across the globe. There are projects being driven by Google, by Microsoft, by Apple on a Fitbit that Apple tries to do on its own watch, on the toxicities of chemotherapy drugs, to a co-pilot exercise which Microsoft is trying to do with multiple entities across the globe on various case personas. But what it's going to do is typically what technology does in the space of clinical enability. So if you look about a decade and a half back, we were at the cusp of change where robotics enabled doctors to do much more than what they could do with the human hand. Where doctors could have the dexterity of a rotational movement beyond what the human hand could do, perceive and actually access eloquent areas which were thought not accessible. We're going to see the advent of robotics moving to AI-driven interfaces in clinical programs where both the consumer, that's the patient, and the doctor, and the entire pathway of people in the network of the care are going to be far better informed through an AI platform than what they could be without it. And the advent of this is going to see a huge shift in the way the practice is being done, because data is going to be the driving force through data lake, machine learning, and the AI algorithms. They're present in various forms today. There is AI-driven pathology, there's AI-driven physics, there's AI-driven treatment protocols. But what we are trying to do in the AI-driven precision oncology center is to get into precision diagnosis, to understand the diagnosis which is bespoke for an individual, and how does that lead to a pathway to give them actually precision oncology care, and how can we get these neural networks which is there in data to actual physical networks, AI driven, closer to the care pathway, that the person could be in a distant place but still connected to a tertiary care center, to a multidisciplinary tumor board, and to get into the larger access point of infra and technology, for him to be better enabled and better empowered through AI to take the discovery pathway of how to actually meet up to what are the challenges thrown in with a condition which could be largely be disabling, and move to actually something which is enabling to live the quality of life and a better opportunity or a chance to win over the cancer. So to me here, it's a huge catalyst in the enabling pathway, and that's what AI is going to do. And there are multiple projects across the globe, and some of them we are involved in, and there are some of them which are being work in progress with a multitude of other entities. And we are seeing a lot of discussion around AI. The challenge today is which of those work and which of them actually will progress to enable a larger thinking of actually which will live to have an implementation which will be impactful.
Yeah. So this precision oncology is applicable to all sort of cancer at every stage. Help me understand that. How does it work?
So we are currently at phase 1, where we have driven this across 6 cancer types. We haven't got the entire process defined for all cancer types. There are multiple types of cancers. We did a prototype to launch the first one around breast cancer. And when we did the launch on the 19th, we presented a case, an example, when we did multiple customers where we are providing deep patient insights into their core journey when they got diagnosed with breast cancer, and actually create a whole lot of value add services through an AI enabled, which will help in rapid diagnosis to leading patient engagement automation to create actual outcomes. So currently for 6 cancer types, we are able to do right from an AI chatbot engagement to an AI algorithm for risk reduction, to an automated operational workflow, to an automated clinical workflow, and then post-cancer care, continuum of care. Early stages, but I think we are in the right direction with a couple of clinical partners that we have created for this project. We hopefully would get to see more cancer types folding into this platform.
Yeah. So these are the patients who want to opt for these services, are those who have been diagnosed with breast cancer in the current scenario, or are they ones who have been who are suspected cancer patients? And once they reach the center, what happens then?
So there are 4 case scenarios here. It could be anybody who's just going in for a screening, right, and actually not even aware that he or she is probably susceptible to some cancer type unless he or she undergoes screening. Second could be a person who's already got diagnosed somewhere. Third could be a person who's seeking an expert opinion because he or she is in some geography where the clinical topography doesn't enable her to get an expert opinion. The fourth could be a person who's living a life who has got a recurrence of cancer and has had cancer before and has got probably a breast cancer. Now he's got a secondary, which is somewhere in the brain, coming back to it. So it currently for these 6 cancer types, touches between screening and diagnosis to actual staging of the cancer, getting into a multidisciplinary team which provides an option for the patient, to actually getting the care pathway and to live life after cancer. It could also involve in phase 2 multiple diagnostic centers and screening centers which could get hooked onto the platform. So there's a trigger and a notification as soon as some form of malignancy is identified, which will create in a data lake a set of data points for consumers to understand what can we do from a primary care setup to a quaternary care setup, where data could be the driving force for a consumer who could be distantly or remotely inaccessible to the best of care, but could have through a network of partnerships, which we call the Apollo Oncology Alliance, to get even distant centers to hook on to the platform. We're still not there because we are testing our program. We want to make sure that it's run well. We have a certain size of patients, and then we understand that study. Then we will probably come into a version 2 of this, or a version 1.2 to understand this better, and then figure out how can multiple of them embrace the concept of AI-enabled POC. While it's the first one in India, and the magnitude of the problem in India is huge, from the fact that while we report 1.2 and 1.25 to 1.3 million new cancer patients, and at any point of time there are 5 to 6 million. I was on a dais with some of the policymakers in the country recently when we launched it, and I said the biggest problem in India is not every district and every state needs to notify cancer as a notifiable disease, because there's no policy or bill which is passed. So you actually don't even know what's the magnitude of the problem. And without knowing the actual magnitude of the problem, we would not even probably understand how do we find a solution. So in that platform and through your medium, I'd like to urge various policymakers in different departments across the country, either at the national policy level or at the state or at the district, to ensure that cancer gets to become a notifiable disease. So we also understand and work together with stakeholders to understand the magnitude of the problem, to figure out how we can work with tech and through various stakeholders to actually address the issue. Okay. Today, to me, that's one of the biggest problems, because cancer is not even a notifiable disease in every state in India.
Yeah. So in a country like India, where healthcare expenditure is largely out of pocket, cancer is often very devastating for individuals as well as families. So in that scenario, do you think, will it make the precision oncology, make the services, the treatment, the care more expensive? Do you think it's scalable? A large number of patients can actually benefit from it? What do you see as potential for this service?
So I'll draw parallels to this to a study done in the UK, which is called the NICE study, which says cancer not treated right the first time makes it very expensive. What we are enabling to do through the AI-driven POC system, or the embrace which we want to do under the Apollo Oncology Alliance, is instead of a person being in a remote or distant place, or where there's a gap between the number of clinicians or the number of oncologists, the number of patients, that the consumer or the patient does not have the time to reach a tertiary care center and meet a large multidisciplinary team and understand his cancer type and stage and what is the right treatment, probably might get a suboptimal treatment, and the recurrence could be very costly. What this enables is to actually get a patient who's got a particular cancer type to beat the best of clinical talent in a single quaternary setup, which will connect to the AI POC. So the patient at the first time gets the best opinion. And this is through a platform we will be launching later this year. It's called the Expert Opinion Platform, where the National Expert Opinion Panel across India we have created. And we have created the global consortium of 40-odd international centers which a patient can access. The intent here is to actually identify the cancer type and make sure you get the most optimal treatment with a group of clinicians who come together, interlinked between the AI POC centers and the hub and the center of excellence, so that the patient has a better chance to win over cancer rather than have a recurrence, or get to actually not get a treatment done and come at a later stage when things gets actually very, very challenging and very costly. To interplay between private setup and public, a large problem in India is not only the number of people who are insured, is the quantum of insurance. One of the biggest points of discussions which are not being discussed at every policy level is what is the quantum of insurance taken by a person rather than saying a percentage of the population is insured. Taking an insurance policy for a lakh of rupees in India probably itself is a starting point problem, because how much of that would get you access to healthcare in private enterprise? So saying I have an insurance policy is good as start, but what is the quantum of insurance that a person needs to take who's got a genetic predisposition or has got an hereditary cancer type or is living through a certain age with a set of trigger points which shows that forward going he or she might lead to a particular disease category, is to also to be defined. So the biggest problem in India is actually the under coverage of insurance to the population who are also insured. And the biggest problem is the people not taking insurance. While the government's made a lot of efforts on introducing the Ayushman Bharat and other programs, a lot needs to be also done. And I'm glad that we're heading in the right direction with the cervical cancer program, because a lot of cancers in a few years to come would probably get eradicated, because vaccination is the only way you can actually prevent largely. And then you need to actually figure out how do we keep people not leading to a program by actually getting into a preventive healthcare program where he or she understands forward going that these are my trigger factors and my risk factors and what changes I need to do to my lifestyle, what I need to watch out for, rather than actually getting to an episode which happens and leading to a medical intervention. So the answer here is as simple as this. Multiple studies across the globe shows that if you do not get your treatment right the first time, multiple episodes of recurrences or you having to face it proves it to be very expensive. And by us getting the cancer care closer than ever before through the AI platform, connecting the coronary centers and a lot of clinical talent through the multidisciplinary tumor boards, will enable a patient who is far off from a tertiary care center to get a coupled opinion, which is based on years of practice, publications, evidence, progressive oncology practices today, rather than just get a single opinion.
Right. So Apollo has been a sort of a pioneer in offering many cutting-edge treatment plans in the country. APCC or Apollo Proton Care Center is one. Now this Precision Oncology Center. What is next? What are the new exciting, areas that you are looking to deliver services in?
So under precision oncology, I think one of the turning points which we will get to see is how do we treat cancers which traditionally through traditional practices or norms of evidence-based, say chemotherapy or something else, have failures. And a large role is got to do there in the role of cellular therapy, moving forward to gene therapy. I think we would very soon make an announcement slotted for the first week of February on Apollo Network's multi-city, 8-city program on our partnership with some of the innovative providers on
really
announcing
sorry, but
case of something else fails, how cellular therapy could be a boom for people of treatment.
Last bit, so if you could just repeat yourself, sir, about your partnership.
Okay, so we're talking about an announcement that we'll make very soon in the era of what's going to happen in cellular therapy, where Apollo has partnered for a pan-India, multiple city participation to announce cellular therapy for different cancer types. And this is the early stage to be talking about where cellular therapy is finally leading to. The next phase could be gene therapy. So there are multiple clinical programs in the space of precision oncology, which would be announced by us as we ink partnerships. We partner with tech providers, drug discovery companies, and companies which are in the space of cellular therapy. And I think the advent of precision oncology will move to the direction of cellular therapy, gene therapy, immunomodulation, targeted therapy, combination therapies between radiation and medonc. And the very early announcements in the cellular therapy will happen in Feb.
Okay, that's really interesting. Look forward to the announcement and get the details for this. So thank you so much for joining us and for sharing all the insight and information related to precision oncology. Thank you so much for joining. Thank you so much.
Thanks. And it's an absolute pleasure, Smiri, to be connected with you in ThePrint. And I'm highly delighted to participate in this program. Thank you.